Welcome to our poster presentation, When Joy Turns to Sorrow, Simulations and Nursing Student Reflections Surrounding Perinatal Loss. My name is Dr. Susan McDonald and I am your narrator. This poster was created by Dr. Susan McDonald, Associate Professor at UT Health San Antonio, Dr. Sara Bishop, Associate Professor at Stephen F. Austin State University, Nacogdoches, Texas, and Dr. Laura Sisk, Assistant Professor at UT Health San Antonio. This is the completed poster. How the poster came about was I, Dr. Susan McDonald, taught at Stephen F. Austin State University before I moved to San Antonio, began teaching at UT Health. Dr. Bishop and I had done a thematic analysis on student reflections at SFA after they had completed a fetal demise simulation. When I came to San Antonio, Dr. Sisk had told me that she had done similar work with students at UT Health. We realized that a lot of our work was very similar, and we decided it would be a good idea to compare our results and see what the overarching themes were. Thus, a collaboration was born. I will now speak briefly about each section. So the background for this simulation was we realized that there's very limited opportunities for students to take care of patients experiencing perinatal loss, and that high fidelity simulations have been shown to be effective in teaching students about end-of-life issues as well as caring for low and high-risk maternal newborn patients. There really are a lack of studies using fetal demise scenarios in undergraduate education. So the methods that we followed was we looked at the literature, and that's when we realized that there were so few studies. And we looked at our simulation scenarios, and they varied a little bit at each setting. One was intrapartum at UT Health, and the other one was postpartum at Stephen F. Austin. Each did focus on caring for families physically and psychosocially with an emphasis on communication. In both scenarios, the students answered specific reflection-style questions independently and anonymously in writing. A thematic analysis was then conducted looking at both sets of reflections, and the results from each institution were compared to find any overarching themes. So the first scenario we'll talk about, it was at Stephen F. Austin, where we had the patient and her family. They were done by high fidelity mannequins, were being cared for in the immediate postpartum period. The students took the cue from the family as to how they should proceed and how they should, if the mom requested to see the baby, they brought the baby to the mom's room. At UT Health, they used a standardized patient to act as the mother, and this was a patient who was admitted to labor and delivery after complaining of no fetal movement at her OB-GYN's office. The students cared for the patient throughout her labor and delivery process. So when we looked at themes for our both studies, we realized that what we were seeing that arose the most was fear and apprehension, what do I say, and being prepared for the future as nurses. So fear and apprehension, that one really spoke the loudest to us. The students really it made them uncomfortable. They didn't know what to do. They didn't, this was completely new to them. So fear and apprehension was that overarching theme. What do I say? They really had a difficult time trying to say what they wanted to say, but they learned a valuable communication lesson. And they all felt that going through these simulations helped them as nurses for the future. These are our list of references, which most of them are very current. I encourage y'all to look at the references if you have an interest in this particular area in maternal child nursing. Again, we want to thank you. Our contact information is included in this slide. And don't forget about next year's Nurse Educators Conference in the Rockies, which is going to be held from July 19th to the 23rd, 2021. Thank you.